I got to UC Riverside about 2.5 years ago. And I went there because the medical school really is very innovative and forward-thinking, community-oriented, health disparities-oriented, and actually really wants to do something to help the community, which those of you know is not the typical view of medical school. So, and I was hired to start a community engaged research center. And the things that made the most sense, because we were starting from scratch, were the Corey Engagement Awards. So we applied for those. This is the first one we got. We have now gotten 3 of them. And this is the first one we did, which was with the Latino community. And let's see, how do I make this? Okay. This shows the mission statement of our Center for Healthy Communities, which is a lot like the mission statement of the school. And this was crafted in a series of meetings with community members, and I won't go into that. But what we are going to do is talk to you about this particular project, Latino Health Riverside. So the goals of this project were to engage 3 predominantly Latino neighborhoods in Riverside and to identify the community's health priorities and to build capacity for community engaged research. And one thing I really want to point out is where we were starting from. I have worked with organizations such as Loretta's Healthy African American Families in the Arkansas Delta. That is minority-owned and operated organizations who've been there for years and have the trust of the community. There was no such organization in Riverside, the city of Riverside, or really in Riverside County. So we were in a situation where literally we had to start from the bottom up. And one of our biggest concerns was, how do we really engage grassroots people? Because the typical thing to do is to go and talk to the leaders. And so Mary, who grew up in Riverside, is an elected official for the community college system, spent her entire career really in the criminal justice system, and now she is retired, which is kind of a joke. But without Mary, we could never have done any of this work. So I'll just quickly show you these neighborhoods that we were working with in Riverside: Arlanza, Casablanca, and the East Side where Mary grew up. And these are the 3 neighborhoods that are about 75% Latino in the city. And I'll also show you a picture of our steering committee, which consists of representatives from those communities, as well as some of our faculty, as well as people from public health, people from Inland Empire Health Plan, and now we've incorporated a number of people from mental health, because you'll see what we found from this community. And this represents the process that we used, and what Mary and I are going to do is that Mary's going to describe the first part of the process, I'll describe the middle part, and then we'll also describe the last part, the meeting that Jeannie attended. So,
good afternoon. So, Mary Figueroa, and as you heard from the introduction, I predominantly have been involved in the community in the city of Riverside, but it's mostly been in the social justice and criminal justice relating to violence. We've had quite a few issues out in that community, and so most of my work has been in that arena. On top of that, my professional history is also involved in there, because I spent 21 years with the Department of Corrections as a correctional counselor out at the California Institution for Men in Chino. So with that background, it continued into the community. So this was relatively a new thing for me, engaging the community on health issues. And the one thing though that I can tell you, and I knew this from history, all the decades that I've worked in the community, was how do you get the community to respond? They will respond in a crisis, everybody does, but they won't show up unless there is a crisis, unless you go to them. So therein lies the in-home meetings. As you can see in that first graph, the in-home meetings was something I came up with that has been utilized at a different level throughout the country, I'm sure. I know that there was something in San Diego that was something similar to it. The concept that I thought of with the in-home meetings was, if anybody here remembers the Tupperware parties of the heyday?
Oh, yeah.
Okay. There was also Sarah Coventry jewelry parties. There was also crystal parties. All of those parties were successful because they were held in a home and they invited people that were their neighbors, family, friends to come to the house. Now most of us went and we understood why we were going. Well, the in-home meetings follow that concept, but this time we were asking people to talk about health. So we had, in these 3 neighborhoods that you saw just previously on the graph, we had 3 meetings in each of the neighborhoods. We could have had 5. We could have had 10. That's how many they were requesting. But time-wise and staffing-wise, there was no way for us to do it, so 3 each. In those 3, they were held in the community. We did not ask the community members to come to the university. We did not ask them to show up at City Hall. We didn't even ask them to go to the community centers, in some cases that were just around the corner. We went to them. We selected homes that people would graciously open to us, and we provided the one thing that I will tell you is critical when you're trying to get the community there. I'm sorry, it works every time, and that's food. Okay? We provided the dinner or the lunch, whatever it was that the meeting was centered around, we brought it. The host was just that, a host. And so the in-home meetings were successful. We met in living rooms, we met in garages, we met in driveways. And I have to tell you that the driveway meeting was probably, for me, the most inspirational. Because that woman that held that meeting, that's all she could offer us, but she offered it. And so when we showed up, just very quickly, when we showed up, the house had, the little boy was just putting up white and pink balloons on the fence line. On the chain link fence, because they were so excited that we were going to have this meeting, and all they could offer was the driveway, but that's where we went. And we had these meetings there, and that's what happened. They were small, they were intimate, they were teen to seniors. We had all the statistics that, we won't have time to share with you, but that's how it started out. And the discussion was health. What's important to you? It was not us going to them saying, we know what you need. This is what we're going to do for you. No. We were going to them and saying, the topic is health. You tell us what's important to you, to your familia, to the gente that you know what's important, to your neighbors. And it worked. The next one that we had, and this was also another follow-up, it was town halls. The reason for the town halls is this. The community is used to having sometimes people come into the community and saying, we're going to come in, we want to ask some questions, we're looking at doing some work on this, or this. They come in, they ask the questions, they're gone. We never hear from them. We never know what happened to that report. Whose shelf is it sitting on? Gathering dust. So as I indicated to Dr. Sullivan, we need to go back out and we need to report to the community What happened in the in-home meetings? What was the result? Let them know that we're still paying attention. So town hall meetings, they were held. Those were held in community centers because they were larger. They had more than 30 people, maybe 50 people, but we ended up meeting and we ended up telling them, look, we've been meeting in your community. You may not have been at the in-home meetings, but this is what we did. Those also worked because it continued the conversation and the communication with the community. And that was the key.
So at these in-home meetings, we took a lot of notes so that pretty much everything we did subsequent to that was based on what we heard in those meetings. So what we used was a model of civic engagement developed by the Kettering Foundation, which they call deliberative democracy. And we used that model, actually I was taught this model by my community partners at Tri-County Rural Health Network in the Arkansas Delta. And so we use modified versions of that really for the rest of what you're going to hear, and I can tell you some more about how that works later. I'm not going to go into that. But the first step is you take the information, we took the information we got from the in-home meetings, and we had what's called framing sessions. And what that is about is sort of grouping these phrases and things that we heard into key areas. And let's see, the 4 key areas that people were most concerned about in health were these: neighborhood safety, chronic physical health conditions, access to care, and mental health. So those were the 4 top areas. And then we did deliberative democracy forums to prioritize these. You know, if you had to focus on one of these, and the way you ask these questions typically is if you had $100 million and you were going to put it into one of these, which one would you put it into? And so that ended up with mental health as number 1. Much to my surprise, and I think to Mary's surprise, of course, and I can't say I was delighted, but I was glad that it was something I knew something about because I'm a psychiatrist, or I should know something about, I should say. And I'll just comment on that about, before we go to the next point, was to sort of narrow down, you know, what within mental health is important. I think, having heard this now, and I will say this, from rural African Americans in Arkansas to Latinos living in more urban areas. We also have a project with San Bernardino Riverside Indian Health Service. Every one of these communities, mental health, if it's not the top concern, it's in the top 2 concerns. There was just a big survey done in the Coachella Valley. Mental health, mental health, mental health, mental health. And I think what people mean by that is not really necessarily what we researchers think about. It's really a lot about it's really a lot about social determinants and how you live day to day with the stress of having few resources. And then there's this, you know, historical trauma for all of these groups. So this is what I think, you know, people are talking about when they describe mental health concerns. Not entirely, but it has a huge flavor in all of these groups. Now, the next thing we did was a very structured approach that was more traditional deliberation. And I will say, in order to do this, we had to produce some educational materials for the community members attending. And they needed to be in Spanish and English. And I was so lucky to have a young woman from, who was a graduate student from the University of Washington who was from Casablanca. And she came down and did a preceptorship for me. And one of the things that she worked on was this presentation to the community on mental health. It was astounding how little we could find about mental health that was particularly for Mexican Americans, which the predominant group, Latino group in our area are Mexican Americans by far. We could find a little bit from we found some things from Santa Barbara, but mainly it was about East Coast Latino groups, Cubans, Puerto Ricans, and I was really shocked by that. And I think it's a real indication of how little has really been done in this area around education and other things like that. So now Mary will tell you a little bit about the gathering meeting.
So at the culmination of this, one of the things that we needed to do was we needed to call everybody together, basically partners, community people, everybody. So what we did was we convened a meeting of approximately 100 people. At first, I know Greer was like real nervous about, the fact that we're getting 100 people there and they were probably going to enter the room and kind of go all over the place. But what we did was that we convened the meeting, but we made sure that it selected everybody from across the spectrum in the community. Stakeholders, meaning professional people, county people, each of the medical regional type populations that have services out there, the local government, city hall, even the police department. We even made sure that all of the cross sections in the community were there. We had 15 tables as it resulted of 7 people at each table to make it manageable. 4 of them were strictly Spanish speaking. That was a great surprise and a great thing for us to know that we actually had that many people that were going to be sitting at the tables and they were only Spanish speaking. So we accommodated them perfectly. At that gathering, we basically ended up doing exactly the same thing, but it was much more structured because they actually had a session where not only did they talk about these 4 points that you see up here at this point right now, these were some of the questions that they were asked to kind of give them a guide as to how to talk about these particular issues. But each of the tables, when I assigned them, and I did end up being the one that assigned them because I probably know the majority of the people in there, I made sure that none of the same community sat at one table, that it wasn't all government at one table. I wanted to make sure that at each table, you had government, you had police, you had community, you had clergy, you had everybody at that table that could share their experience with each other. Because you have to remember one thing, a lot of times, this is the first time some of them have seen each other. And they don't really know and have never heard some of the other concerns. So that was the other aspect that we did, was an awareness and education component to all the partners at that gathering.
Yeah, so we did present this video that we pieced together, and I spoke in English, and Alejandra, the young woman from Washington, spoke in Spanish. And each table deliberated, that's what deliberation is, weighing options, these 4 options. And this was probably way too structured, but I felt like this would give us a way forward in terms of thinking about research. So just to let you know what people said about these. On the first one, it was divided. Half thought prevention was more important, half thought improving treatment for existing disorders. So mainly the view was this is a continuum and we should be concerned about all of it. The second one, you can probably guess some of these. Children were seen as a really important target audience. And the notion of community education and stigma reduction was number 1 in the next question. And then, again, you might not be surprised, I know Loretta won't be surprised, people wanted services provided in the community. So those were the main The main fund, we just did this literally a few weeks ago. So that's where we are. And, you know, we want to move forward. We've already been to talk with the county mental health about this. They were particularly intrigued with the in-home meeting approach. And so we hope that we will be able to pilot a project where promotoras go with us to the in-home meetings, because it became fairly clear that even though there have been promotoras in these communities, they haven't really been reaching people.
One of the things, if I can interject here, one of the things that was really clear, the services are available, or at least they're offered into the county. The county is out there. The point ends up being that the community is saying, yeah, the services are there, but what kind of services are they, and are we welcome? We had a lot of questions, a lot of comments from the community saying they did not feel welcome at the clinics, at the appointments that they went to. Either somebody didn't help them with the paperwork, or there was a issue with language. Whatever it was, they were not welcome. And if that concept is out there, somebody mentioned it earlier, that concept will get around and nobody is going to tell anybody else about, you need to go down there because they'll help you. They're not going to do that. And so that was the other part that came up, and I have to tell you, my last comment is, a lot of the agencies, unfortunately, at some of the meetings that we had, the town halls and stuff where we gave the information back out, they were very defensive. They were very defensive, asking us, well, where did you get that information from? Who told you that? Well, the point here ends up being, why didn't you know? That's what the point was for us. Why didn't you know? You're providing the service. Why are you asking us? Who said that?
So I just quickly, we did a lot of capacity building. This is just a quick slide to show capacity building, which we won't describe. And we have lots of people to thank. This is our slide to thank so many people. And here are the names of our steering committee. So we thank you for the opportunity.